Hello viewers, let me introduce myself. My name is Han and here the audience with me today is Andrew and Natalie. So today we will discuss about antihistamine drugs, to be specific about H1 antihistamine drugs.
Let's start from the definition. What is H1 antagonist?
An H1 antagonist is a histamine antagonist of the H1 receptor that serves to reduce or eliminate effects mediated by histamine. In type 1 hypersensitivity allergic reactions, an allergen, a type of antigen, interacts with the cross-linked surface immunoglobulin E antibodies on mast cells and basophils. Once the mast cell antibody-antigen complex is formed, a complex series of events that eventually leads to cell degranulation and the release of histamine from the mast cell or basophil occurs. Once released, histamine can react with local or widespread tissues through histamine receptors.
So, tell us please how the allergic reaction manifests externally.
As histamine acting on H1 receptors, externally it will manifest as pruritus, vasodilations, hypertension, flushing, headache, tachycardia, bronchoconstriction, increase in vascular permeability, potentiation of pain, and more. And the interesting thing is, while H1 antihistamine help against these effects, they work only if taken before contact with the allergen. As all drugs, H1 antihistamines have their own classification, and then Andrew with Natalie will continue to talk about it.
I will tell you something about the first generation group of antihistamine drugs. The most commonly used of these antihistamine drugs is dimidrol. In the world, dimidrol named as diphenhydramine. So, diphenhydramine has anticholinergic, antitussive, antiemetic, and sedative properties. We use dimidrol for treat allergies, insomnia, some psychotic diseases, and in treating nausea. So let's speak something about pharmacokinetics of first generation of antihistamine drugs. Bioavailability of dimidrol from 40 to 60%. Protein binding 98-99%. Metabolism of dimidrol or diphenhydramine mostly metabolized in liver, where cytochrome 450 takes the most main part. Half-life of dimidrol 8 hours it's for children, and from 9 to 12 hours it's for adults. Excretion of dimidrol mostly by urine 94% and 6% through feces. Let's look on target side effects of diphenhydramine. Biological targets: H1 receptor, which localized peripheral. Mode of action: inverse agonist. Effect: allergy relief. H1 receptor, which localized in central nervous system. Mode of action: antagonist. Effect: sedation. Also, diphenhydramine has some biological targets like MACRH receptors, Nat3 channel, SERT, and also they have some other effects and mode of actions. Adverse effects of dimidrol. Diphenhydramine is a potent anticholinergic agent. This activity is responsible for the side effects of dry mouth and throat, increased heart rate, pupil dilation, urinary retention, constipation, and the high doses, hallucination or delirium.
The next group of drugs is second generation. The most commonly used pills from this group is loratadine. Loratadine is indicated for symptomatic relief of allergy, such as hay fever, we know it as allergic rhinitis, urticaria, or chronic idiopathic urticaria, and other allergic diseases. For allergic rhinitis, loratadine is effective for both nasal and eye symptoms like sneezing, runny nose, itchy or burning eyes. About a few words about caution and contraindication. Patients with severe hepatic disorders may need to start with a lower dose No dose adaptation is necessary for elderly or renally impaired patient. Loratadine is usually compatible with breastfeeding. As for adverse effects, as a non-sedative antihistamine, loratadine causes less, but still significant in some cases, sedation and psychomotor retardation than the older antihistamine because it penetrates the blood-brain barrier to a smaller extent. Also, drowsiness is rare at the common 10 mg dose. Patients should nevertheless be advised that it can occur may affect performance of skilled tasks like driving. Loratadine and alcohol are unlikely to cause problems. Other possible side effects include headache and antimuscarinic effects such as urinary retention, dry mouth, blurred vision, and gastrointestinal disturbances. Loratadine is tricyclic antihistamine which acts as a selective inverse agonist of peripheral histamine H1 receptors. Loratadine is given orally, is well absorbed from the gastrointestinal tract, and has rapid first-pass hepatic metabolism. It is metabolized by isoenzymes of the cytochrome P450 system. Loratadine is almost totally 97–98% bound to plasma proteins. Loratadine's peak effect occurs after 1 to 2 hours, and its biological half-life is on average 8 hours.
We hope this information was useful for you, and thank you for your attention. See you next time.
Goodbye.